I am Dr. Mindy Fritz, and I am going to talk today about the viral vector vaccine, uh, which has been recently improved, and that's the Johnson & Johnson vaccine. So going to go through, there are three different coronavirus vaccines in development, at least three of them. And we'll skip to number three because that's the one that we talked about earlier. That is the mRNA vaccine, if you'll remember. That's the one that takes the mRNA, puts it into a little lipid nanoparticle, and then it creates those spike proteins that your body can produce antibodies against those spike proteins. So that is the Moderna and that's the Pfizer vaccine that's been around for several months now. The other vaccine that's still in development is a protein based, where basically the whole spike protein is manufactured, and then that spike protein is injected as a vaccine, and then that creates the antibodies. That your body can then use to create memories and fight coronavirus if you were to get infected. But the one we're going to talk about today is a viral vector vaccine. And the way that works is, again, we're taking that genetic material for just the spike protein, not the entire coronavirus particle, but just that spike protein. We isolated just that genetic sequence for the spike protein, and that is encased in a viral vector. What the virus that's used is adenovirus, which is a common cold virus. So that viral particle has been purified and deactivated so it can't cause a cold, it can't cause an infection anymore, but it gives us that vector that we can insert the spike protein genetic material into that viral particle, and then that can be injected as a vaccine. And what that does then is that creates the spike protein, and then again, our bodies make those antibodies against the coronavirus, and then we create those memory cells. So if we're exposed to coronavirus in the future, then we have those memory cells, those antibodies that are made very quickly to help fight that infection. And again, this is just another picture of how that viral vector vaccine works. You have that viral vector, which is that weakened cold adenovirus. The viral genetic material for the spike protein coronavirus is injected into that viral vector, and then that creates the vaccine that's injected into our bodies. And then that genetic material makes those spike proteins. Our body recognizes those spike proteins as foreign spike proteins. They're not meant to be in our body, and then that creates antibodies to attack those and get rid of those spike proteins. But then those antibodies are the memories. So if we're exposed to the actual coronavirus virus in the future, we already have those antibodies, those memory cells that can very quickly be made and fight that coronavirus infection if we were to get infected in the future. So who was this Johnson & Johnson vaccine tested on? The safety of the Johnson & Johnson vaccine, it was trialed on 43,783 people, ages 18 and older in several countries, 45% female, 55% male, and then quite a wide range of ethnicities also were in this trial. The most common side effects that were noted from the vaccine, where you get the shot, you may have some pain, redness, or swelling. You may have some systemic effects, tiredness, achiness, headache, chills or fever, nausea. And those side effects usually start within a day or two of getting the vaccine, usually last 1 to 2 days, but then they usually go away. So side effects are common within 7 days of getting the vaccine, mostly mild to moderate. And it's actually younger people, those under 60, were more likely to have side effects compared to people 60 and older. This vaccine does not contain any eggs, preservatives, or latex. So if you're allergic to eggs or latex, there is no contraindication to getting the Johnson & Johnson vaccine. And so how well does the vaccine work? It's 66.3 effective against preventing COVID-19. The most protection is 2 weeks after getting vaccinated, and it had a very high efficacy at preventing hospitalization and death in people who did get COVID after vaccine. And in fact, no one who got COVID after receiving the vaccine had to be hospitalized. So the early evidence also suggests in the trial that it may provide protection against asymptomatic infection. And there's more research being done to verify that information, but that's very exciting, great news, may help prevent some of these asymptomatic carriers. And so the advantage to the Johnson& Johnson is it's just one dose, so it doesn't need you don't have to remember to come back for that second dose. And also the adenovirus does not need to be super cold to keep it stable, like the Moderna and the Pfizer does with that protein nanoparticle. So in clinical trials, what they do is they measure how well a vaccine prevents illness in a controlled setting. So that's called the efficacy. So 95% efficacy does not mean that 95 out of 100 people vaccinated will be protected from COVID-19. It means that the vaccine reduces the amount of disease by 95% for all vaccinated people compared to the placebo group or the people that did not get vaccinated. And almost all three COVID vaccines, the Pfizer, the Moderna, and the Johnson & Johnson, are almost 100% effective against the severe disease, and that is hospitalizations and deaths. So these vaccines work, and they work very, very well. Just kind of a summary of the three vaccines. We have the Pfizer, the Moderna, and the Johnson & Johnson. Pfizer and Moderna are the mRNA. They are 2 doses. Peak effectiveness is 2 weeks after that second dose. Johnson & Johnson is the viral vector. It's a 1 dose, and again, 2 to 4 weeks after that dose is the peak effectiveness. Mild side effects are not uncommon, usually within a day or 2 of getting the vaccine, and then usually subside within 1 or 2 days after developing symptoms. And so they are very good at preventing symptomatic COVID-19 infections. All of them are very good. So the question we always get is, which vaccine is the best one to get? I want to get the best vaccine. So remember, the whole point of vaccines is to decrease uh, illness. So the more people to get infected with a virus, the more variants that happen. This happens with every virus. Every virus mutates just a little bit. The more people it can infect, the more chance of it mutating. We're seeing this. We're seeing this with all the variants across the whole world right now. And so the goal of the vaccine is to decrease infections so that we can stop seeing these variants. And so it's still a race between vaccination versus variants to keep this case count low. The key to ending this pandemic and getting everything back to normal and getting us to be able to rip off our masks and having increasing crowds and people getting together and doing things, the key to ending the pandemic is getting people vaccinated across the entire globe as quickly as possible before these variants become too variant and too different that the vaccines aren't as effective. So the best vaccine to get is the one that you can get today. Does not matter if it's Pfizer, Moderna, or Johnson & Johnson. It's the one that you can get today. And if you live in Ohio, go to the website gettheshot.coronavirus.ohio.gov, and you can get signed up to get the COVID vaccine today. Thank you.